morning. I have the distinct pleasure this morning of introducing our keynote. Dr. Casey Chosewood has been with CDC for 20 years. In the last 13 years, he's been with NIOSH. He's the Director and Senior Medical Officer of the NIOSH Office for Total Worker Health. So without any delay, I'm going to turn the podium over to Casey Chosewood.
Good morning, everybody. This is usually where I say I'm from the government and I'm here to help, okay? I do want to be helpful for you today. It's really a great pleasure to be with you, and I love the applied part of this conference. We in government sometimes get criticized for not being as applied as we should be. You know, we sponsor a lot of academic research. We do a lot of research in our own laboratories at NIOSH. And it's really important for us to think about how people are going to use the knowledge that we help achieve. We fund 32 education and research centers across the country. We fund 10 total worker health centers that I direct. So getting that information out into the hands of people who can actually make a difference for workers really is an important part of our work. And we need to do a better job. So if you have suggestions for us on how to make our work more applied, I'll give you a way to reach us at the end of the talk. I'm especially happy that we have so many folks here who are in training, who are students in the field, and who are workers giving their input, participating in decisions each and every day through developing better solutions for healthier, safer work in your workplace. So the Ergo Cup Challenge, to me, is an excellent applied opportunity to move what we know into the hands of people who actually are going to benefit from the work. That is perhaps the most important function of government when you think about the knowledge gaining potential of the large amounts of your tax dollars that are spent. How can we actually, at the end of the day, improve your life? And that's going to be some of what we talk about this morning. Most of us have to work, right? It's not a choice for most of us. Most of us have to get up every day and go to the office or go to the factory or go to the enterprise and make a difference. And it's not always immediately clear if we're making a difference in the work that we're doing. It's especially true in government. When I was a doctor seeing patients every day, I knew if someone came in and I gave them pain relief or I helped them solve their acute problem, their infection, I set a broken bone, I sewed up a bleeding wound, I knew I was helping them immediately. Today, working in public health, and probably for many of you, we don't know to what extent we're making a difference. And that's important, because if you look at what makes a good job a great job, what makes you happy to get up and go to work every day, there are a few core essentials that our research shows really do make a difference. And one of them is, does my work make a difference? Does somebody get better because of what I do? Does someone live happier? Am I making a difference for our society as a whole? So if you're in charge of a group of workers, helping them understand each and every day how their work makes a difference is very, very critical to their overall health. It's very critical to their overall well-being. And I'll make the argument that that's an important element of their safety as well. If I know I'm making a difference at my work, on the job, I look at that enterprise and that work differently than if I'm unsure of that connection. So as we talk more about how to apply this concept of total worker health, I want us to continue to come back to, does my work mean something to me and other people? That's going to be critical. And many of the solutions that you put in place each and every day help that occur. Other things people tell us what makes a job a great job. Money makes a difference, right? Wages, as they rise, tend to lift all boats, so to speak. If there were one intervention to make more people happy on the job, pay them more, right? Pretty much goes without saying. But that's generally not enough. Many people will take a job that pays less for other certain benefits. And you ask folks, what is the number one benefit I want to have a great job? Flexibility. Most people would prefer more flexibility day in and day out than more vacation over the year. People will trade a job that gives them the flexibility to work at home a couple of days a week, take a cut in pay. In fact, hybrid workers, according to the latest survey, on average, make $20,000 less a year. But people are clamoring to get those hybrid jobs. People want a job that allows them the flexibility part of the time to work at home. $80,000 average on-the-job worker compared to doing the same work, coming in 5 days a week, makes $80K. Hybrid, $58K. Those are the averages, just came out this week. So people are, day in and day out, trading higher wages for more flexibility. What else makes a great job? Having people around you that you care about. Many people report their best friend at work. Their best friend in life is someone at work, a coworker. So those connections around us, those people that we spend much of our waking hours with, really do matter. So I would say that a great solution to improve the work experience is to build those strong social connections at work, encourage them, make those opportunities available for people to bond on a very personal level. Those are the things that will make a difference. Now, you notice we haven't talked about safety at all. We haven't talked about keeping people injury-free. Yes, a safe workplace matters, but so many of these other elements, those sort of above-the-neck issues, if you will, those are really what keep people on the job, which keep them coming back, which keep them engaged, which keep them involved in their day-to-day activities. Work as we know it, we've probably said this a million times, rapidly changing. We're going to go over some of those details in just a second. But today's work is a combination of new hazards, ones that are really going to hit us sort of blindside, with a lot of traditional hazards still in the way, still uncompletely resolved. So it's definitely important to, when we're thinking about the hazards that workers face, to look at legacy hazards as well as new hazards that are on the way. One of the biggest challenges workers tell us they're struggling right now is high levels of stress and high levels of mental health concerns. So it becomes increasingly important for us to address those issues as we are trying to create a better work experience for our workers. Many Americans at CDC, as we do national surveys, tell us that they're in survival mode still. They haven't fully yet recovered from those challenges of the pandemic. Lingering pandemic effects, supply chain issues, caregiving issues, political divides continue to bother certain experiences at work, global unrest, inflation. Many people still report all of these things are additional stressors that are making it more challenging for them to fully return, to bring their full selves back to the workplace. Here you see 1 of 3 employees say their return to regular work has had a negative impact on their mental health, and they're feeling anxious and depressed. And if you look at some of the national surveys, we're seeing that even into 2023 and early 2024. Many folks lost jobs during the pandemic, but we've seen that recover nicely. And that's encouraging because having a job, for the most part, is positive for your mental health. Unemployment has many negative health effects related to it. So working, in general, is a very positive element when it comes to people's overall health and well-being. The pandemic, though, did cause some pretty dramatic changes if you look at national trends. Our longevity dropped significantly, 1 to 2 years on average for men and women across the board. But if you look at some populations, those losses were far more dramatic. Alaska Native, Pacific Islander, American Indian, we had 5-year drops in life expectancy in certain subsets of our population. The good news is, just reported this week by CDC, life expectancy is recovering. The 1 to 2 years that we've lost, now we've gained about half of that back in 2023. So we're happy about that. Unfortunately, though, we did see an increase in suicides post-pandemic and during the last part of the pandemic, with certain groups more affected than others. We also saw an increase in overdose deaths as well. And you're like, well, I'm not sure what overdose deaths has to do with the workplace. We're going to make a strong argument in just a second that there is quite a connection between those two. And it's partly tied in with the mental health challenges that the nation's facing. It's partly tied in with some of those overall stressors and the angst that people are still recovering from post-pandemic. Would it surprise you to know that we have 250,000 new orphans in the country because of the pandemic? So 250,000 children lost one or both parents due to COVID-19. We're still also concerned about delays in diagnosis of certain chronic diseases like cancer and heart disease that may have been postponed because of the pandemic. That could likely increase risks down the road as well. These are some statistics from mid-pandemic that I think still deserve our attention. Anxiety and depression reported by 1 in 3. Those who started or increased their use of a harmful substance, 13%. So that's 1 in 7, 1 in 8. Those who seriously consider suicide, 1 in 10. What we really saw during the pandemic, and these numbers point that out, is we saw compression of some of these issues that normally play out over a lifetime, compressed in a very short period of time. So for example, it's typical over the course of all adults that about 1/4 will have major depression or anxiety over the span of the lifetime. We saw numbers higher than that diagnosed in a span of 2 years. So we compressed the morbidity, if you will, over a lifespan into 2 years. That not only increased the risk for people because more people are struggling, but it also led to a shortage in care providing for those people who needed those mental health services. And that was a significant challenge that absolutely impacted our workplaces. We saw especially difficult conditions in some subsets of workers. Health workers and educators reported numbers that were double this. Half of healthcare workers during the height of the pandemic said they plan to leave the profession. And that number has not yet recovered. It's still 40% in latest surveys, both suffering from burnout, feeling just emotional and physical exhaustion, as well as high levels of intention to leave the profession. This is an interesting finding too. Did the pandemic change the nation's personality? And I'll read it here just so it can sink in for you. Early on, there were limited personality changes early in the pandemic, and I'll step aside now. In fact, most people's mental health improved the first few months of the pandemic. Why is that? So maybe 3 to 6 months in, people's mental health actually improved. Some people argue that it's sort of a shared experience. We're all in this together. So there was sort of a supportive element, a societal coming together, if you will, to face a crisis. So mental health originally improved, but as the pandemic wore on, things changed. But striking changes, it says, started in 2021. Of most note, the personality of young adults changed the most, with marked increases in neuroticism, which means excessive worry, and declines in agreeableness and conscientiousness. That is, younger adults became moodier and more prone to stress, less cooperative and trusting, and less restrained and responsible. So it argues that this was a shared national phenomenon that actually changed our personality. That clearly is something that can play out in our workplaces. Overdose deaths during the pandemic also started to rise. And many argue it was because people who did have an underlying substance use disorder either increased their risky behavior or they were kept away from the support systems and the recovery systems, the treatment systems that may have protected them or kept them out of a substance use disorder. Unfortunately, overdoses are still, though, a problem in 2023, years after the pandemic. 107,000 or so deaths reported by CDC from overdose, and that's more than car crashes and gun fatalities combined. Most of these folks are within the working age range. That's more than 150 people per day just from opioids, and there are other drugs involved in overdoses as well. We're seeing increased overdoses from stimulants like cocaine and methamphetamine, but fentanyl and other fentanyl analogs, similar opioids, are responsible for most of the deaths in this country. And in many overdoses, in fact more than half, there's more than one substance involved. So it is a complex issue. And clearly there's still stigma, shame, and all of those things are challenging the intervention. Overdose prevention is now one of CDC's top priorities because, again, it impacts people at all ages, but especially younger adults, and it has consequences for families and folks with substance use disorder who don't obviously have overdose. It's challenging on many levels. So what is the connection between work and overdose? Because it's not immediately clear if you start thinking about it. Well, we mentioned unemployment, not having a job. That in and of itself is a predictor of substance use disorder and overdose death. Having a job that predisposes you to injury is a predictor of substance use disorder and overdose death. So if you're in an industry where injury rates are higher than average, that increases your risk. In fact, the gateway drug, if you will, to opioid use generally is not something like marijuana. It's a prescription opioid. And the workers' comp system and our injury care system after workplace injury was a common source of opioid prescriptions, especially a decade or so. It's improved as we've recognized this connection, and opioids are now given for shorter period of time at lower doses with a smaller pill count. So that has decreased the connection to some extent. But nonetheless, many people with opioid use disorder report their first entry into heavy use was from a legitimate prescription. Having a job that predisposes you to pain, or a job that's low wage, so you have to work many, many hours, also a predictor of heavy opioid use and overdose risk. We also see the risk factor play out in certain industries and occupations more than others. Would it surprise you to know that the leading cause of workplace death for the entire state of Massachusetts in 2015 and 2016, workplace death was drug overdose? The leading cause. It wasn't motor vehicle, it wasn't fall from height, it was a drug overdose. And that was largely reflected in two working subpopulations in Massachusetts: construction workers, and in truth, they have 5 to 7 times the death rate from opioid overdose, as does the average worker, and cold water fishing off the coast of Massachusetts. We see high rates of overdose in fishing, agriculture work, oil and gas extraction, mining, construction we've mentioned. What is it about these jobs that predispose to these outcomes? It isn't folks who go into construction are prone to opioid use and overdose. It's the nature of the work. It's the way that work is organized. It's the boom and bust of that economy. It's the pain-producing, the injury proneness associated with some of these jobs, the seasonality, the periods of intermittent employment, work hard, boom and bust, and then have nothing to do for a couple of months. That insecurity of income and employment is a strong predictor of overdose death. So all of these things implicate the need for better work design, for better approaches to addressing some of these challenges. I would argue that substance use, overdose risk, and mental health are all important workplace considerations. They're all important for us to optimize the work experience, because these are leading causes of death in the prime age group that we're talking about. Suicide, also not universally the same across all industries and occupations. Again, we see high rates in construction, certain service occupations. We see it in certain healthcare workers. We see it in public safety, unfortunately, where people have access to lethal means. That includes medications and firearms. So these are important workplace issues for us to address. Let's talk about some solutions during the last half of our talk today. Tom mentioned that I lead the Total Worker Health program, and for us at NIOSH, Total Worker Health is really trying to look at that interface between work and the rest of our lives. And that's why things like substance use and mental health are important considerations. So I'm going to tell you quickly the story of 3 companies to get your head wrapped around what Total Worker Health is. So the first company, they fell on job number 1, which is, as you can see here in Total Worker Health, keep workers safe. So this job has no attention to safety obligations. So basically, their workers are trading their health for wages, and they go home at the end of the day with less health than when they arrived that morning. It's really not, up to par. That's bad for its workers and not sustainable. The enterprise can't sustain itself if it continues to do that. The second company does a little bit better. They do keep their workers safe. So at the end of the day, their workers go home with the same level of health that they arrived with that morning. Okay, they've met their OSHA obligations. They've met their keep the workers safe. That's great. Those workers go home with the same level of health. A Total Worker Health company, though, does more than just keep their workers safe. They invest in the health and well-being of their workers through the 3 Ps of Total Worker Health: better programs, policies, and practices. And they add things to the work experience that actually improve the quality of that work. And at the end of the day, those workers go home with more health than when they arrived that morning. You think, okay, that's great. I want one of those jobs. I would like for my work to be health producing instead of health robbing, right? But you say, well, what's in it for the company? Why would they do that? Why wouldn't they just stick with just keeping their workers safe? Well, obviously, at the end of the day, those workers go home with more health. It's good for their families, their communities. They can work longer if they choose to do so. But the next morning, they wake up with higher levels of health, and they bring those back to the workplace, back to the enterprise. And that translates into better performance, less arguments with coworkers, less spending on health care, less injury, more productivity, better customer service. That is the cycle of positive gains from paying attention to both personal and work-associated challenges. That continuous cycle of improved health and well-being. Sounds like a tall order. We got lots of companies who are making it work. Some of them here today who have Total Worker Health programs in place. Some of the companies here, I saw Dorn is here. They have a strong Total Worker Health training element. Many of the companies that are represented here have implemented Total Worker Health strategies. Again, keep workers safe. Add in those policies, programs, and practices that actually grow health with the measurable impact of greater worker well-being at the end of the day. Worker-centered problem solving, much like you're seeing happen with the Ergo Cup Challenge, is an extremely important element of the Total Worker Health approach. Giving workers more voice, more control, more autonomy, more decision-making capacity, extremely important in increasing their enjoyment and their meaningfulness of their work. Equitable wages, good benefits, good leave, lack of paid sick leave, strong predictor of people having to work with pain or taking pain medication to come to work. Another implication of poor work design, not paid sick leave, leading to opioid use disorder. The role of supportive supervision, helping our frontline managers gain the people skills that they need to do a better job of supporting workers in their day-to-day tasks, recognizing them, giving them that voice, letting them participate, all important aspects of supportive supervision. Ergonomists and work design are like hand in glove, right? We believe that work design is essential to the total worker health experience. And then attention to work and how it fits with the rest of our lives, extremely important. People are not work selves and home selves. They're one self. We have to be cognizant of the connection between those two environments. We don't leave all our challenges in the parking lot when we come to work. They come with us. And vice versa, when we have stressors at work, we take them home and they impact our family and our relationships. So optimizing both ends of that spectrum is critical to making a good work experience for folks. Our research shows that total worker health approaches decrease workplace injuries and illnesses. The first cost dollar savings with total worker health is on the workers' compensation side. Fewer injuries and illness, fewer workers' compensation costs. People are also more satisfied. Total worker health leads to decreased turnover. People say, yeah, I'm not only going to stay, I'm going to encourage my friends to come work here as well. That's really the mark of your success. How many of your workers would want one of their either family members or close friend to come work there? If you get a lot of yeses on that question, you're doing something right. In fact, if I had one well-being question I might ask my workforce, that would be it. Would I recommend this job to a close family member or friend? Why? Because it means that I feel like I belong here. I feel like this company has my back. I make a difference here. I get the wages and benefits and respect and the supportive supervision I need to make a difference. And yes, I want other people to have the same experience. It's an excellent measure of how well the company is doing. Our study showed that total worker health approaches, because largely of the flexibility and supportive supervision, decrease worker stress. Productivity goes up, healthcare costs go down. That takes several years, according to our research. Trust, belonging, engagement, all improve. Because this connection between non-work and work, very important for us to say that total worker health approaches don't blame the worker for their own personal shortcomings or their personal medical issues. It's not consistent with workplace policies that discriminate against or penalize workers for their individual health conditions, and it's not a wellness or health promotion program that's implemented without addressing unsafe work practices first. Safety first. It's the bedrock of the total worker health approach. Like many of you in the traditional safety world, we use a hierarchy of controls as well when we apply total worker health, eliminating those both home and work conditions that increase risk, substituting with better policies and programs in your workplace, redesigning the job itself, the work environment, the work experience. And then lastly, we rely on education and encouraging personal behavior change. It's not that we don't feel they're important, it's just we know those upper elements on the hierarchy are much more powerful and much more capable of doing a better job. Let's shift as we end to talk a bit about how we'll all work in the future. Some industries are reporting already wide gaps between the number of workers they have and the number of workers they need. And we do expect shortages in workplaces in many industries and occupations to be a consistent issue for the next couple of decades. And that's largely because new types of work are needed, perhaps not even predictable yet, where new skills and new job approaches will be necessary. So we expect labor shortages to continue to be challenging many employers. Innovation is going to be a constant. The only constant thing will be change, and the need to continue to reskill, upskill, change the skill level of workers, extremely important. AI, we expect to disrupt both low and high wage workers. In fact, about 12 million workers will need to find a job by 2030. Folks, that's only 6 years away. And that's like 10 or so, almost 10% of our workforce that will be shifting because their jobs will no longer be needed. And many of these workers will have to find work in a completely different field from where they are now. Certain industries are going to be impacted more than others, and technology in general is going to rewire every aspect of the work experience. And for some workers, especially older workers or less educated workers, this will be a significant challenge. So as you're introducing technology, it must be human-centered. So technology decisions must be made through the eye, through the lens of the workers you have there. Extremely important. Without that, you're going to see significant increases in workplace stress. We expect psychosocial workplace risk factors and attention to them to become front and center. We also expect growth in the severity and frequency and diagnosis of mental health conditions. And there are more and more discussions. In fact, if you look at some of the trends, more and more workplace claims related to mental health are appearing in work compensations systems. So the connection between working conditions and work stress and workplace injury or illness is being drawn more clearly and more closely than in the past. So that's another very important reason for us to strongly improve the overall experience of work for workers. There are additional calls for national standards and enforcement related to psychosocial risk factors. In fact, the U.S. trails all other countries in the utilization of standards around psychosocial and mental health risks at work. We are really pushing worker well-being as a strong metric because it encompasses both the safe workplace and the healthy workplace, both the physical safety and the psychological safety. So that's going to be, I think, a very important element to the best workplaces of the future. A little bit more on job loss related to AI. As I mentioned, 12 million workers finding new work by 2030. This will lead to higher paying work for some, but not in the same industry for 9 million of those 12 million workers. Automation will displace workers across 4 different fields primarily: office support, food service, customer service, and workers who move material or work machines. These 4 categories make up about 40% of jobs in the US. Workers earning less than $38K are 14 times more likely to lose a job by 2030, and folks with less education, women more than men, and people of color will be most impacted. This draws our attention to how using total worker health programs can impact and can improve the work experience for some of those higher risk workers that we just mentioned, those most prone to job loss, those most prone to some of the poor mental health outcomes. We believe total worker health programs can help identify health disparities and safety outcomes across demographics. And we'll introduce a tool in just a second that will help your workplace do that. We also think that attention through total worker health approaches can show that low-wage work and risk overlap. And when you're designing interventions, it is okay to invest more in higher-risk workers and in higher-risk groups of workers. Perhaps putting more intensive and more frequent workplace interventions for your lowest-paid workers. In general, that will yield more results. We're recommending also training frontline leaders to focus on people skills, belonging, and engagement with DEI goals in mind as well. So as we wrap up, I'll ask, are resilience building programs like EAPs and Lunch and Learns enough for modern workplace hazards? And I would argue that they're not enough. We need to go back to our core principles of work design, participatory approaches, giving workers more voice, a stronger say in their working conditions. People who are closest to an issue not only understand it, but they're also best positioned to help design a solution to whatever problem or challenge may arrive. And if they have a voice in coming up with that solution, they're more also likely to support it through the implementation and bring others along to support that improvement, that fix, if you will, as well. Resilience building reminds me sort of the turtle. You can ask a turtle to grow a harder shell. And in many ways, resilience building is asking workers, hey, grow a harder shell so maybe we can hit you with a bigger hammer, or so we can throw more stings and arrows your way. You can do that, but a harder shell comes at a cost and a price. Much better to decrease the stings and arrows, to decrease the size of the hammer, instead of asking our workers to grow a harder shell. Our NIOSH mental health portfolio covers several different areas here, so we have a wide range of resources available for you. Please feel free to reach out for those. I'm happy to help any of you as you move down your total worker health journey. One of those resources is a new way to measure worker well-being. We call it the NIOSH Well-BQ for Well-Being Questionnaire. And it's 68 items, a 15-minute survey, really easy to do in your workplace, and it will help you prioritize what are the well-being challenges that your workers face. Where should we use limited resources to begin to address those well-being issues? Very easy to do. You can customize the demographics the way you wish to do that. We obviously want you to respect the privacy of your workers, so many companies choose a third party to administer it, or they do it through their occupational health medical record system. That's another way you can do it to protect privacy as well. If you're ready to get started, Total Worker Health has some easy out-of-the-box solutions for you to have available. We recommend you use some kind of surveillance tool to ask how your workers are doing, find out what their well-being challenges are. The NIOSH Well-BQ is one of those. Also pay attention to your injury and illness claims and work hard to identify what are the underlying causes of those challenges. Get worker feedback on the programs, policies, and practices you have. And if I had $1 to invest, I would put the majority of it in increasing the supervision skills, the support skills, the people skills of your frontline leaders and management. I make the argument every day that the frontline manager you have is more important to your health than your personal physician. They have so much say, so much control in your day-to-day work experience. That is a critical piece of a successful workplace program. Invest more in those frontline managers and leaders. And then lastly, identify those areas where you want to intervene based on your listening sessions, based on your survey, prioritize those actions, assign tasks, develop accountability, and then reassess your progress on a regular basis. Our research comes from 10 funded centers across the country, including one at Johns Hopkins that only studies workplace mental health issues. This is where all of our evidence base comes from. All the underpinnings of the 15 years of total worker health have arisen from our centers of excellence. They all have wonderful tools, resources, outreach programs. Some of them have pilot grants to help you actually start a total worker health solution in your own workplace. We have 58 total worker health affiliates around the country. These are our learning living laboratories. Your organization or one you represent could potentially be our next affiliate. We're always open to that. We also have some new resources on substance use disorder because of the growing connection between substance use and working conditions. So please check those out. Here are ways to stay connected with us. And I'll just end by saying that, I came to work every day because I wanted to help people. I'm retiring at the end of this year. You're one of the last groups that I'll get to speak to. And I now start to think about what work is going to be like for my granddaughters. Lily, who's the oldest, and Lily and Emery, her younger sister. She just turned 11, and I asked her yesterday, the youngest one, what do you want to be when you grow up? And she said, a princess. And it's like, oh, I don't think the job market is all that good for royalty these days. But I didn't discourage her. It's experiences like this that continually remind me that work is so critically important to your life, to the lives of your family members, your friends, and to your children in the future. And I just want to, because of that, because it's so critically important, I want to thank you for your contributions to the health, safety, well-being of those workers in your environment, those ergonomic problems you solve every day, those engineering solutions you bring to workplaces. Thank you for that. Thank you for having me here today. Enjoy your conference.